Dear friends, the main organ affected in COVID-19 is the lung. We have to take all the possible measures to protect the lung. COVID patients develop upper and lower respiratory symptoms. These include nasal congestion, sore throat, difficulty in breathing, cough, and other respiratory symptoms. Some patients develop pneumonia and sepsis. Happy hypoxia is another critical condition of COVID-19 where the patient is asymptomatic until they collapse. In this video, we will explain how to improve the functions of the lung and boost the immune mechanism of the respiratory system.
The aim is to have healthy lungs to bravely face the COVID pandemic. For this, you must breathe effectively. How do you breathe? When you breathe in, does your neck and shoulders raise, and simultaneously the abdomen contract? Or, do you just feel your chest rising and falling when you breathe? Well, most adults breathe this way. This is shallow breathing, where you are not drawing in air throughout the lungs. Shallow breathing is known to cause a lot of medical conditions like metabolic disorders, panic attacks, anxiety disorders, asthma, pneumonia, sleep disorders, neck pain, etc. On the other hand, deep breathing or deep thoraco-abdominal breathing is where you are actively pulling the diaphragm down with each inward breath. As a result, the lungs fill more efficiently. The ability to breathe deeply and powerfully is present in all healthy babies from the moment they are born. You were actually born with the skill to breathe deeply. Unfortunately, as we grew older, our breathing became shallower and shallower, and we rarely paid attention to it. For most of us, breathing is just an automatic process. But, humans are the only species who can actually regulate their breath. So, we have to relearn to breathe deeply. Now, take a deep breath. Pause. To make space. To collect your thoughts. To remember. To face the next moment. To choose. Choose to consciously irrigate your entire system with oxygen. During this pandemic, most people feel overwhelmed and experience high levels of anxiety. As soon as a person hears the words that they are COVID positive, their anxiety level skyrockets. When anxious, oxygen saturation in the blood drops, the pH in the blood becomes acidic, your blood pressure shoots up, and your digestion is impaired. All these conditions will not help in your recovery. It actually paves the way for COVID-19 complications. By intentionally breathing deeply, you can reduce anxiety and hasten the recovery process. In order to breathe deeply, we suggest you to do 3 basic exercises. Firstly, clean the nose with warm water. Blow out 2 to 3 times. Then, take black cumin seeds or Breckland thyme or yarrow flowers. Put inside a cotton pouch. Crush them. Inhale on both nostrils 5 times each. Next, do slow and deep thoraco-abdominal breathing. For this, sit down. Keep your spine erect. Relax completely. Place your hand on your belly, below the belly button. Now, take slow and deep breaths. Observe your belly rise with each inhalation and contract with each exhalation. The next exercise is gentle voluntary hyperventilation. For this, sit down. Keep your spine erect. Now exhale fully and quickly. Inhalation will be a natural process. This exercise can be done fast or in a gentle manner. We advise you to exhale only in a gentle manner. You can hyperventilate 50 times in one sitting. If it is uncomfortable, then do 20 or 30 counts in one sitting. Then, take a deep breath, relax, and start again. These breathing exercises can be done in the comforts of your home. It should be done early morning in empty stomach, or 3 hours after eating food. It can be done by persons of all age groups. It can be done whether you are COVID positive or not.
Respiratory system is secreting a lot of immune substances to protect us. By doing these exercises, you will saturate your blood with full share of oxygen. It will boost the immune mechanism of the respiratory system. It will also improve the pulmonary functions and functions of autonomic nervous system, thereby reduce anxiety. So, simply breathe properly.
In each respiratory cycle, an average adult inhales or exhales air only 10% of the maximum capacity of the lungs. With intentional deep breathing, we can increase this capacity significantly. The oxygen saturation in the blood also increases. Go ahead, try these exercises, and measure your blood oxygen level with an oximeter. Deep breathing exercises done properly, joyfully, regularly, and consciously till it becomes part of the personality, can help to prevent critical COVID conditions of hypoxia and hypoxemia. So, we highly recommend doctors handling COVID patients to understand these techniques, so they can help their patients better and reduce load on ventilators in hospitals. If you have COVID-19, do not panic. That is the best you can do. For God has not given us a spirit of fear, but of power, and of love, and of a sound mind. So, bravely face the health challenge. Contact us on our COVID-19 helpline numbers: 960-581-6897, 9445-116-897 in India, 38269-330057 in Montenegro, Europe.